The doctor who operated on the wrong patient, and no one noticed. It began like any ordinary Tuesday at St. Mary's Hospital. Fluorescent lights buzzed, coffee carts rattled, and the morning team moved with the quiet efficiency that comes from seeing emergencies every week. Dr. Harold Jensen reviewed the chart for a routine appendectomy. He had done hundreds. This case was marked straightforward. The pre-op nurse wheeled the patient in. The consent form sat on the tray and everything looked right on paper. In the pre-op room, the anesthesiologist leaned toward Jensen and said something that lodged in the air. "This man insists he doesn't know why he's here." Jensen shrugged. "Nerves," he said out loud. Then, because the moment needed an audience, he muttered, "Like and subscribe a Yahweh Stories, 44, as if to anchor the world he was watching unravel. The patient's eyes were wide and blank, not frightened so much as displaced. The electronic records insisted the man was Richard Whitman. Name, photo, history. The wristband printed O negative. The band on his arm read A positive. Charts noted years of abdominal complaints. This body was soft, unremarkable. Nurses scanned IDs, refreshed tabs, and found everything consistent, except for the small, stubborn contradictions that made the room feel too quiet. They prepped, scrubbed, and began the incision. A young nurse leaned in, voice athread. "Sir, this isn't Whitman." The scalpel paused. The anesthesia monitor chimed, then chirped in odd syncopation. Monitors showed vitals that shouldn't be possible. Pulses that climbed like stairs, then flattened like a horizon. Oxygen levels sliding in slow, mathematical arcs. Jensen's hands tingled. The sterile field felt like a stage. The room contracted and swelled. Ceiling lights dimmed and flared in time with the monitors. A low patient hum filled the air. It felt like the building's bones remembering a tune. Jensen tried to step back and found his limbs slow as if moving through honey. The patient's eyes opened and, for a sliver of impossible time, glowed like something reflecting from another world. "You're in the wrong timeline," the man said, voice flat and almost bored. The sentence landed like a second incision. Jensen's training insisted on control. "Call the lead, secure airway, stop the case." Those commands slid off the hum. Numbers on screens warped. Respiratory rates read like codes. Blood pressure rose in impossible symmetry. The OR clock breathed unevenly. Seconds pooled and spilled. Instruments clattered from a distance as if an invisible team continued work in a parallel corridor. Then the OR blinked out. Jensen found himself alone in a hallway, gloves on, scrubbed blood on his palms that could not be matched to any chart. Downstairs, the theater played on. Logs and cameras recorded a flawless operation. Appendectomy complete on Richard Whitman. Whitman, however, was home that evening, unoperated and confused by calls from nurses checking recovery. Jensen reported the event. Protocol demanded a statement. Risk teams promised reviews. Reviews returned clinical charts, signed consents, anesthesia notes, and time-stamped confirmations. CCTV showed empty floors and routine lights. Colleagues offered sympathetic smiles and suggestions about stress and sleep, but the hum stayed. It lived in flickers above his office and in the building's plumbing. In sleep, the hospital rearranged itself. Wings shifted, portraits opened into strangers. Corridor numbers counting in sequences he couldn't place. Once, lights in the parking garage blinked, long, short, long, in an order that spelled a date he never recognized. He stopped operating. He walks the hospital now like a man checking for doors that aren't there, palm flattened to drywall to see if it's skin. He tells the story quietly to residents, who nod politely and jot it down as a cautionary tale. Nurses change the subject. Friends laugh. Nights became a geography of small terrors. Jensen woke to monitor chirps threaded through traffic noise, to the phantom scent of antiseptic in his kitchen, to the metallic memory of instruments under his pillow. Once he found a single surgical glove folded inside his briefcase, clean and warm, as if someone had left it there minutes before. He picked at scabbed skin on his palm that he didn't remember opening. Each trivial finding felt like proof that the hospital had left a breadcrumb trail. He wonders which timeline will answer when he knocks.
Don't forget to hit that bell, like and subscribe button. For more history mysteries, horror, and so much more.